Hello, I'm Dr. James Nill, Nill Family Chiropractic and Wellness Center, and today we're going to talk a little bit about headaches. Now, there are three different types of headaches that we're going to talk about today: migraine headaches, cluster headaches, and tension headaches. Migraine headaches are very common, and a lot of people don't think there are actually cures for that. But actually, migraines are most likely, in many cases, misdiagnosed as tension headaches. But if you have a migraine headache, usually you'll find the symptoms on one side of the head, and there are also different things that can come before the migraine starts. You can have what's called photophobia, or the light will actually bring on the headache, or you might be annoyed by sounds and might have a little nausea or dizziness. Those are all signs that a migraine is coming on. And then when you have a migraine, a lot of times people just can't bear anything. They just have to lay in a dark room. A lot of things you can do to try to help with migraine headaches. You can do acupuncture, and especially chiropractic can help. Besides anything else, sometimes you have to figure out what's causing those migraine headaches, and one of the reasons could be a chemical problem. Maybe an allergy or something else that brings it on. You'll find a lot have to do with chocolate allergies. But today we're going to actually show you how we can actually treat migraine headaches. Tension headaches are a different story. There's some muscles that are behind the neck, which I'm going to show you in a little bit, called your suboccipital muscles, and that's where a lot of your tension is carried. So what we need to do is work on those muscles and try to figure out how we can release the tension in there, and the headaches will go away. Now, cluster headaches are a little bit different because we don't know exactly a lot of times what causes them. They just are really sporadic and they come on and off as we go. A lot of times you'll see things that have to do with different structural components, and those sometimes require surgery, but most likely with chiropractic adjustments and therapy we can actually treat that. This is what I was talking about when it comes to tension headaches. These are suboccipital muscles right here. You can see three different muscles that come around. They actually attach to the skull and to the spine. And these are primary deep muscles that help hold your head up. Now, when we have stress and tension, this is where all of the tension goes, and it causes the headaches. You can see with these trigger point referrals here to come right up the side, and that's where you're going to get your headaches. So what we do, and this is the same concept for every muscle or joint in the body, is that there's all three different muscles, just like the rotator cuff, to help guard that area. So what chiropractic manipulation does is it actually stretches these muscles real quick. It sends a signal to the brain, which sends a signal back, which turns the muscle tension off and instantly releases pressure in that area. Okay, now that I told you a little bit about headaches, I'm going to show you exactly what I do to treat those headaches. Alright, the first thing I want to do is use moist heat. These are moist hot packs, and we're actually going to put them on the suboccipital area and a little bit back here, because a lot of times when you have problems here, you get tension all the way down the back too. That's when I treat the headaches. I usually treat the whole body as a whole, not just the head, because all these muscles are all combined. So usually she'll lay here for about 10 minutes, 5 to 10 minutes, and just let the heat soak in, and then we'll start with the next part of therapy. Another thing I do, and a lot of times some people have a lot of tension in here, is I do what's called therapeutic ultrasound. Now, this isn't like the ultrasound you get when you go to to your gynecologist to look and see what the baby sex is or whatever. This is actually a deep heater. What it does is it sends a sonic wave down to the bone area, and that reflects off to the deep muscle tissue, so it gets real deep. So what I do is I put the ultrasound gel in, and then I set the different coordinates depending on what level, and we just kind of move it around for 8 to 15 minutes, depending on how much time it needs to get the tension up. After the heat, we usually do a little massage, and that'll help get into the muscles. And then we can use this massager in here, but I highly recommend, and what most of my patients do, is they come in and they actually get a massage done by a professional massage therapist to help loosen up the muscles for me. So that way when I do the manipulation, it's a lot more smooth and it has less rebound effects. In other words, the body doesn't reject it the next day. Now, the next part is manipulation. And some people do not like the regular manipulation part, so what we do is we do what's called activator therapy, which is a little device, and what it does is it shoots a little mechanical impulse into the joint segment, which does the same thing, and it stretches that muscle real quick to send that signal up to the brain, which sends a signal back, and it turns off that muscle spasm. So you hear a little clicking noise, and it doesn't hurt. It's just real quick. So what we're going to do here is you're going to have her turn her head. Relax. We're going to do a little manipulation that way. Take a breath in and out. Now what you'll do is you'll hear a popping noise. And that popping noise is just gas being released from the joints that gets caught in there. It's just like popping your knuckles. It's the same concept for every joint in your body. Okay, now the next phase of the treatment is to actually come in here with my hands and work on the suboccipital muscles. Now this is called myofascial release, but what I'm doing is working on the origin and insertion of these muscles. What that does is it helps reset these muscle patterns a little bit more to help prepare for the adjustment. So after we do the release, kind of work on those, then we come in here, relax, and it's real quick, not invasive, and you hear a cracking noise, and then we end it with a little bit of traction, and that's all she wrote.